15 years ago, the people of Santa Cruz County wanted a report card for the community. So in 1994, United Way started a community-wide effort to create a quality of life report. Applied Survey Research designed the county's first report, known as the CAP. 15 years later, ASR continues to reshape the CAP report to link data to community action. The CAP brought together over 1,000 people to create shared goals for the community, and it now measures over 130 indicators in 6 areas: health, education, economy, public safety, the social environment, and the natural environment. We now have 15 years of experience using good quality data that leads to action. Here are some of those stories.
Well, 15 years ago, we began the community assessment project because we were curious about whether or not we could measure the quality of life in Santa Cruz County in such a way that we might be able to, where we found problems, be able to create programs to address some of those problems.
At the time the CAP started, we really didn't understand the status of our community and how we were doing as a county. We weren't sure where they were making progress or not in health and education, economy, social environment, natural environment, public safety. So we said, let's join together. Let's determine what we want to measure, and let's determine the best way to track our progress through time. So it was a 10-year commitment that our group made across multi-sectors to understand what was important in terms of quality of life, to develop indicators and data sources so that we continually measure ourselves to see, are we making the progress that we wanted to make sure that we were improving quality of life for all members of Santa Cruz County.
Healthy Kids was launched in 2004 in order to cover the thousands of children locally that didn't have insurance, and because of that, they didn't have access to comprehensive medical, dental, vision, mental health services which they needed.
The grand jury had a report on the lack of health insurance in our county and what that meant in terms of the quality of life for people who lived here, with the estimate that potentially 40,000 people did not have insurance in our county.
And it became clear that focusing first and foremost on children was perhaps the low-hanging fruit when it came to that problem. And so our community since that time has really invested in universal kids coverage.
Healthy Kids allows children to have a medical home, meaning that there is a primary care physician that is assigned to them that they have to go to, rather than to use the emergency room.
And I'm happy to report to you that right now more than 2,000 youngsters who would otherwise be ineligible for coverage are covered by Healthy Kids.
So the leaders that launched Healthy Kids really were very clear that they wanted decisions and the program to be designed based on what the data tell us. And so it was crucial to have accurate data that showed trends over time in terms of uninsured, in terms of people's access to healthcare services, access to dental care. And that data was found in the CAP report. And so it helped us make sure we were designing a program that was going to really meet the need of the families that we were intending to serve.
We began implementing the Safe Schools project in 2006, and it was a time when there were resource shortages. Alcohol and drug and violence was on the rise, and we were also faced with the pressures of No Child Left Behind.
Safe Schools Healthy Students was very important and vital to the PVUSD district because we needed to create a lot of awareness and prevention in drug and alcohol abuse, and also in violence prevention for not only the students but the parents and the community.
The CAP data shows us, gives us a measure of parent connectedness to schools, and it gives us a measure of how safe young people are in our communities and in our schools.
Go for Health was a really important initiative and collaborative for us to have in Santa Cruz County because our rates of childhood obesity were very high. In fact, they were among the top 10 counties in the state of California for high rates of childhood obesity. And there wasn't a unified, concerted effort to address that issue. The CAP data put all the information about obesity, overweight, nutrition intake, physical activity into one place, and it helped mobilize the community around that issue.
Jóvenes Sanos seemed like a very interesting community outreach program that I really wanted to become a part of because it's involved a lot with bad eating habits, and I know I had a lot of bad eating habits, and it just seemed like a good way to reach out to the community.
We use CAP data regularly to measure our progress in the work that we do. And in fact, in the last several months, we've been using the CAP data as our grounding point to look at how to move forward with our next 5-year strategic plan. It's helped us set our objectives, our goals, and our outcomes because we're able to see where we were and where we need to go.
Very early on, we discovered through the assessment process that there was a considerable problem of drug use among our youth. Members from all over the community came together and formed a program called Together for Youth, successfully applied for grant money to put together programs to reduce drug use among youth.
Basically what we saw when we first gathered some of the data was that we were higher than the national average, we were higher than the state average in terms of substance abuse by youth. And together we were able to work and monitor progress and achieve better outcomes and reduce the incidence of substance abuse by youth in our county.
Well, after doing 4 years of intense work, we found that the more contacts with services directly correlated with the lesser contacts of juvenile hall. So the more services they had, the less they were in trouble with the law, which was really profound.
We hope the community's been changed by the Land Trust by helping the community understand that these wonderful undeveloped lands that we know and enjoy, really only a third of those are permanently protected. So we hope and we will continue to have the community's support in helping to protect a lot of the remainder of our land so that they can stay in the condition that we know them now. It's really important that we preserve the remaining wetlands that we have. 90% of the wetlands in California are gone. There's only 10% remaining. The Watsonville Sloughs, the area that we just protected, is the largest remaining freshwater wetland in Santa Cruz County. When I first came to the Land Trust, I reviewed the CAP, and it was a great resource for understanding trends and attitudes. It's a wonderful assortment of information about the health of our community and especially the way we use land.
These are just some of the initiatives that have come from the CAP. We're now developing new goals to achieve in the next 10 years. We invite you to take action, to join these efforts, to make Santa Cruz County a better place to live.